10 months after Matthew Perry's shocking death in October 2023, authorities have made 5 arrests in connection with the drug that was involved in the fatal accident, and doctors are warning people to avoid Perry's fate. Investigators have determined that the 54-year-old former Friends star's death in his home hot tub was linked to ketamine, which Discover Mental Health notes is a general anesthetic. The drug was not originally intended to be used for psychiatric purposes, but its application has shown some promise as an antidepressant.
With ketamine, we see a regrowth in the interconnectedness and number of these synapses to connect with each other.
Discover Mental Health also notes that there's risk of some serious side effects from ketamine, including high blood pressure, tachycardia, and dissociation. The article's authors wrote, "Investigations into ketamine's effectiveness for other disorders or subtypes, alternate formulations, and its use in conjunction with therapy all require additional study and must be reproduced consistently before being added to standardized treatment guidelines." Charges filed in those recent arrests claim that Perry's doctors, their associates, and one of his employees may not have followed such warnings about the drug. The 5 people arrested are alleged to have either prescribed, illegally obtained, or administered the ketamine that ultimately caused Perry to slip into unconsciousness and drown. A November 2023 article from the Associated Press explains that doctors nationwide may be substituting ketamine for opioid treatment in patients with anxiety, depression, and generalized pain. Even though little research has been done on the safety and efficacy of ketamine as a psychiatric treatment or painkiller, many in the medical field are relying on it. Dr. Padma Galore, a professor of anesthesiology at Duke University, explained why doctors seem to be jumping so quickly to ketamine. There's a paucity of options for pain, and so there's a tendency to just grab the next thing. A medical journal will publish a few papers saying, "Oh look, this is doing good things," and then there's a rampant off-label use, without necessarily the science behind it. According to the U.S. Attorney's Office in the Central District of California, during his last weeks of life, Perry was injected with ketamine that was illegally obtained by Jasveen Sangha, who has been referred to as the ketamine queen, and Dr. Salvador Plasencia. Both Sangha and Plasencia are charged with distributing ketamine as well as tampering with evidence during the investigation into Perry's death.
Defendant Plasencia knew what he was doing was harming Mr. Perry.
Ketamine has limited FDA-approved legitimate applications, but prosecutors in the case are alleging that Perry's doctors and their associates acted more like drug dealers in giving him large, constant doses of ketamine without regard for its known physical effects. Martin Estrada, a U.S. attorney, said, "These defendants cared more about profiting off of Mr. Perry than caring for his well-being. We will hold drug dealers accountable for the deaths they cause." Doctors and officials are warning other doctors and patients to be more careful in their use of ketamine. In an interview with ABC7, Boris Heifetz, PhD, a professor of anesthesiology at Stanford University, said,
"It is the wild, wild west in the sense that nobody really knows the extent of the of use."
He added, "I'm glad that there's some investigating action going on into what was extremely likely to be an inappropriate and irresponsible use of a prescription and non-prescribed ketamine." An August 2024 New York Times article dug into how addicted the actor had become to ketamine in the days before he died. Allegedly, Perry asked his personal assistant, one of the 5 people indicted by prosecutors, to inject him with a big one before he got into his hot tub. The assistant says he was asked by Perry to administer ketamine injections up to 8 times daily. Perry died with approximately the same amount of ketamine in his system as doctors would use to anesthetize patients for medical procedures.